Hi, everybody. Welcome to the August third Friday community webinar, our anti-trafficking program that we offer every month except December this year. And we're so glad you're here with us today. Let me tell you first, though, that the Survive and Thrive Advocacy Center is here in Florida's Big Bend. We're in the Second Judicial Circuit in the Tallahassee, Leon County capital area. We provide direct care and services to all survivors of human trafficking and those at risk. So sex and labor trafficking, minors and adults, immigrant, non-immigrant, US citizens, male, female, no requirements or delineations that are out there with some programs. We work with all survivors. We provide that direct care with our community services advocate and our many partners. So Graciela Marquina is our community services advocate. And we do, our area is one of those parts of Florida where we do have a big city, Tallahassee, and a populated county, Leon. But we're surrounded by 5 other highly rural counties that are so important to us, and how we are doing greater outreach all the time into those areas. We provide tons of community education, and we do it in a lot of different ways, and I'll show you some of our resources in a sec. We also tailor trainings. So I hope some of those claps and those little thumbs ups are people who maybe have attended some of our events, but we also tailor our work specifically to all of you who request it. Next slide, please. So I want you to know that this is our website. You saw it to register to this program. Know that this program will be on our website. When you go on our website, you go under educational resources, and you'll see this webinar in about a week, the recording of it, and you'll see all of the other ones from this year and prior. So know you can always watch this again, share links with your colleagues. If you've learned something and you say, hey, you need to know about this, it's here. And we appreciate you sharing this information as much as possible. They're all free of charge. We don't charge, but you've probably seen little donate buttons on our stuff that we send out to you because they're free to you, but they do take resources. And like everything, we appreciate your support. Several people last time became monthly donors to Stack. It can be $5 a month. It can be whatever. If you get something from these programs and you are so inclined, we'd really appreciate your support there. The other thing is, I'm going to tell you now and not wait till the end, that our next program, we do this every third Friday, same time, is going to be on financial resources for survivors, and a survivor of human trafficking, Holly Nadell, and 2 other experts are going to be talking about how we work together, and the laws and the programs and the things that we can do that after someone's been trafficked, how they can become economically empowered. So that'll be the September program, and you'll be able to register for that. Okay, next slide, please. Okay, so in fact, I will tell you, the last podcast to drop from Stack was one of Holly Nadell. So if you all are podcast people, and if you're not, I encourage you to become one, that you can look at the Imagine Freedom podcast. We interview survivors of trafficking only on this, and it is really for the intention of giving you all information, and us, and I've learned so much for sure from survivors who have been there and want to help prevent sex and labor trafficking, want to help improve, whether you're a parent, whether you're an elected official, whether you're in a system, so we can do better. So it's really not those kinds of conversations where you get book and verse on details of the worst time of someone's life. No, not at all. These are really positive, uplifting, and informative conversations. So there's the QR code to scan. Encourage you to subscribe in any place you get your podcast, or discover what those little icons are on your phone and jump on in. Okay, Next slide. All right. So today, as I said, we are going to learn lots about a new program in Florida, and just still looking at, oh, we have somebody from the San Francisco Bay Area. Welcome. We do have a lot of people from Florida. Really, really eager to hear and learn more about the Bright Project. And let me tell you, we've got two wonderful presenters with us today. Um, Dr. Shelley Wagers is the Associate Professor of Criminology at the University of South Florida and has worked in the field of interpersonal violence for over 25 years as an advocate, law enforcement officer, and now a scholar. How could anyone be more perfect for your job, Shelley? That's what I'd like to know. I mean, really. Your experience and your research includes examining relationships between power and control and violence, along with developing evidence-based practices for policies and programs. She has published. She is extremely skilled in this work and in this field. So thank you very much for being part of our program today. And also, Kaylee Pate Carter is the project manager at the Bright Project, and you're going to learn lots and lots from Kaylee. And this is a project of the Trafficking Persons Risk to Resilience Research Lab. Kaylee has obtained her BA in psychology and her MA in criminology from USF and has a passion for serving others. She's got lots of experience and interest in trafficking and overlapping issues like complex post-traumatic stress disorder, ACEs, and domestic violence. And she has been involved with Bright and this lab since the initial needs assessment in 2020, which you're going to tell us more of the history, but I know that's at the very inception. So you're one of the birth mothers here. And so I just want to say thank you both very much.
Thank you, Robin. And thanks to everybody that is here today. We are very honored and happy that Robin and her organization invited us to come speak and talk with you all about everything we're doing. Dr. Reed wanted to be here today, and we have incorporated into or retained in this presentation all of the content she had planned to present. But unfortunately, she had a last minute thing come up that she could not prevent and couldn't attend. So I want to start with something I know Dr. Reed likes to share with the audiences, and you heard a little bit about my background. And one thing many people have said they find the important or what they like about what we're doing and working with us is that Dr. Reed and I have actually known each other for 25 plus years. So a little bit about our background working together. When I was a law enforcement officer, Dr. Reed was she still is a licensed mental health professional. We were both in Largo, Florida, and she was running for family service centers the volunteer rape crisis response program back then. I had been an advocate for that org before being an officer. So I was part of a program where officers were working with SAVE volunteers to know how to retain evidence, but still do their job, which was support the victims as they were going in for those SAVE exams. And that is where I first met Dr. Reed. And I give that background because she and I both share the same passion as researchers. We first worked in the field and we went back to get our degrees so that our research and our work could have real world application and could be something of benefit to all of you all that are out there. So thanks to all of you for being here. Big passion that we have in the lab is everything we're trying to build or do with these two projects we're going to talk to you today aren't just for us to ask research questions, but really are for us to arm you all with what you need in the anti-trafficking movement to be more effective at addressing and reducing human trafficking, and also more effective and efficient at being able to serve victims and survivors of human trafficking. So on that note, what I would like to do is turn it over to Kaylee, and she's going to start with a little bit of background for you.
Thank you very much, Dr. Wagers. So yes, as Dr. Wager said, we're just going to start with a little bit of background. And as I'm sure many of you have heard, it is very commonly stated that Florida ranks third in the United States. But why is that really? So there's various circumstances in Florida that have created an environment that facilitates human trafficking. These can include disincentives to address the sex trafficking problems, such as fears that it could disrupt tourism, hosting of many large conferences and events, and the image of Florida being an attractive visitors destination. There's also circumstances such as the tacit acceptance of teens running away from foster care settings, thinking that that's just normal adolescent behavior, placing youth group homes in high crime areas due to the lower cost of housing in those particular areas, growing populations of temporary migrant and agricultural workers, and outsourcing some of those services by the hospitality industry can really facilitate some labor trafficking instances. And then, of course, there is the robust and easy access to drugs, in particular alcohol, opioids, and amphetamines. So overall, Florida's susceptibility to trafficking can really be narrowed into four key factors. So the first is it is attractive. So we have a lot of major league sports. There's Disney, Universal, and other amusement parks. We obviously have very wonderful beaches. There's lots of cruise lines. There's just lots of recreation and vacation destinations here. There's also a lot of anonymity as well in our state. So we have large numbers of people that are traveling in and out every day. And when we do have these large events at the attractions, there's large crowds that are always coming in and out. Our state is also very accessible. So we have three major interstates. There's lots of major ports. And of course, we have major airports here as well. And then last, our state is obviously very alluring. So we have very nice weather most of the time, but there's also numerous unskilled job opportunities in hospitality, construction, agriculture. And then there's other features that can draw in homeless individuals, low-skilled workers, runaway youth, immigrants, and various other vulnerable populations to our state. So taken together, the interplay of all of these factors have really created an environment that can ease the facilitation of trafficking in Florida. So an interesting study that Dr. Reed always likes to share, and I wanted to bring to y'all's attention, was conducted by Wallet Hub. So they conducted a study where they compared over 180 US cities across 37 key indicators of what they classified as, quote, evil deeds. But this data set ranged from violent crimes per capita to excessive drinking per capita and the number of adult entertainment establishments per capita as well. As you all can see on this slide, Tampa, Florida ties with Las Vegas, Nevada, Portland, Oregon, Atlanta, Georgia, and falls just short with Houston, Texas for the number of the most adult entertainment establishments per capita. Again, this goes back to that prior slide where it's really just facilitating that environment for trafficking. So really, how do we begin to address this? So as Shelley was saying earlier, Dr. Reed began researching child trafficking in Florida in 2007. So in 2007, the Florida Abuse Hotline did not collect data on human trafficking at that particular time. But after her report on domestic minor sex trafficking came out, noting that they did not have a particular way to track these specific cases, she got a phone call from Florida DCF asking her, what should we do about this? So this has actually been a repeated pattern. Her research would show a troubling issue. So for example, no tracking through the child abuse hotline. Foster care could be a dangerous place where youth can end up being recruited, or those with intellectual disabilities needing further protection. And Florida would respond every single time with new policies and new legislation. I do want to say that she feels very fortunate to have been able to conduct research in the state of Florida on human trafficking because of the responsiveness of our leaders in the state to create new policy and to change legislation that aims to disrupt trafficking throughout our state. However, even with all of our efforts, we do still have unanswered questions about the victims, the perpetrators, the causes, and the solutions. There's problems with accessing good, accurate, and comprehensive data. And although Florida is often cited with the third highest number of human trafficking cases throughout the United States based on incidents and hotline data, we know that that data can have a good amount of limitations. So we do have additional sources of data, but they're often not comprehensive or complete. So with that, we're also missing cases because there's certain circumstances where the data could be hidden as well. So we certainly do know more than we did in 2007. And Florida is a leader in the anti-trafficking movement, but altogether we can do more. So as Shelley said, Dr. Reed was a licensed mental health counselor. And so after she worked as a licensed mental health counselor and she returned to academia and particularly at USF to research human trafficking, she had a vision of bringing together interdisciplinary perspectives to address human trafficking throughout the state. So in March of 2020, Dr. Reed received an internal grant from the University of South Florida to start the Trafficking in Persons Lab here on the St. Petersburg campus. So with that, we were able to bring together multiple faculty from all three campuses who were researching trafficking or allied crimes in various capacities and start the lab and really start to bring this vision to life. So with the lab started, we really had three main goals and pillars that we continue to utilize throughout all of the work that we do in the TIP lab. So the first is knowledge building. We are constantly aiming and working to conduct innovative and interdisciplinary research that works to address the knowledge gaps that exist and impede any advances that we're trying to make in human trafficking prevention and intervention. So with that, we want to build that knowledge, but then provide that knowledge as a resource. So the second pillar is resourcing. So providing those critical resources, including knowledge to the Tampa Bay area primarily, but also all throughout the state of Florida through the establishment of a data depository. So we'll get into that a little bit more later, but that was always a major vision for Dr. Reed in the lab. And then the last is spreading knowledge. So we always want to make sure that any knowledge that we gain throughout our research in the lab, we are sharing any solutions that we find to address human trafficking, because it is really a truly complex violation of human rights and societal norms. But we want to address that from an interdisciplinary perspective. So we want to take the criminological perspective merged with psychological and public health, but also making sure that we're staying victim-centered and trauma-informed as we move through all of these different approaches. So although we are very focused on research in the TIP lab, we do also have a passion for awareness and education. So in opportunities such as this, we always want to take the opportunity to share about the work that we're doing, because we believe that research should not be kept locked away in an ivory tower. So if at any point you all want to know more about really kind of what the scope is in the realm of human trafficking research, please always reach out to us and we will do our best to keep you guys informed of what is going on. We do also post up-to-date information on our website as far as human trafficking research. We're always updating those pages there. And we also try to participate in community events as well, where we're sharing that information that we have gained. So within the TIP lab, so what started with just a few faculty members and just a few students, we've now expanded to 15 faculty and faculty affiliates in the lab. We also have 25 graduate and undergraduate students who are working on 10 different projects. So we do have a variety of different projects in the lab, which range from traditional research, where we may have a theory and we're working to test that theory, but we also do more applied research where a organization may come to us and ask if their program is effective, and they have asked us to really test that effectiveness of their program or maybe a specific aspect of their program. And through all that, not just those initial perspectives that I had mentioned a few slides before, but we've now incorporated 6 different disciplinary perspectives, including criminology, psychology, social work, public health. We even have business informatics in the lab now. So we're really taking many different approaches into our research to make sure that we're really taking a well-rounded approach to any research that we're putting out in the TIP lab. And with that, I am going to pass it back to Dr. Shelley Wagers to talk a little bit more about our very first project that we took on in the TIP lab.
Thank you, Kaylee. Before you go,
Yeah.
before we move into our projects related to the general human trafficking information you provided, there was a question in the Q&A. I thought you could just answer live so we don't lose track of it. Yeah. Which is when you said the allied crimes, they're asking, what do we mean by the allied crimes? And I know this comes back later when we talk about TIPSTR and the law that got passed.
Yeah, absolutely. So this would be things like sextortion or any sort of violent assault crimes. So sexual assault would also be included in that. I'm trying to make sure that I remember and answer correctly. We do look at prostitution as well, because sometimes it is still classified as that. I will continue to go into more detail on that when we go into TIPSTR a little bit later, but I'm happy to continue on that if you would like me to.
No, that's good. I just wanted to make sure you were aware, and then we can touch back on it with TIPSTR again too.
I did not see that pop up. Thank you, Shelley.
No, it's okay. Thank you. So as I move in to talk about the initial project we did, which was a needs assessment in the state of Florida. You can move the slide, Kaylee. There you go. Thanks. I want to first make sure, I know we have some people here from other states. I saw some from California. I'm actually going to be out in San Diego at the IVAT Institute on Violence, Abuse, and Trauma Summit presenting Bright there in a couple of weeks. But I want to make sure individuals out there also know that sometimes questions we get related to Bright as we go is there's an assumption made that this platform or this system is just for direct service providers or NGOs specifically working with just human trafficking victims. So I do want to make sure I say out the gate, that's not the case. And as I go through what we're building, I'll try to make sure I highlight who it's for, but it is literally for anybody who is providing any type of service to someone who could be a human trafficking survivor. So it includes, I saw people from Department of Health are here today, and a lot of our nonprofits that work with survivors and victims. Those individuals need healthcare. So they're looking for places for healthcare for those individuals, and you all do encounter them and see them, just using that as an example. So please don't assume that this is a narrow focus or it wouldn't include you. And if you have questions as to what you do and if it would include you or not, ask it in the chat or ask it in the Q&A so we make sure we address that. The other thing is we're trying to build this as researchers with systems approach, and we've been documenting everything we've been doing with the goal to create what would be a replicable model. So even if you're in other states, we're very open to always collaborating or having discussions to help any other groups or states build anything that we're doing in the lab. So I just wanted to put that out there before we started getting in the weeds on what these projects actually are. So in fall, actually in spring of 2020, we received an internal grant from the university. We remember this date well because as soon as we got the news, it was March, COVID hit, and we went into quarantine. And we thought, oh my gosh, what are we going to do? We're in quarantine. we got this money. How are we going to establish this lab? It actually ended up being, in a sense, a form of a blessing in disguise, because since everybody had to move online, everybody expected when they were meeting with us to be online. So it allowed us to be able to do a much more robust needs assessment that included people from all over the state of Florida versus maybe just individuals in our region, because we were doing all these interviews on Teams and live. So as we moved into the fall of 2020, I led a needs assessment. The goal we genuinely had behind this needs assessment was to really hear from the anti-trafficking stakeholders what is most needed in the state of Florida for you to do your jobs, right? For you to be able to pass effective policies, to drive the dollars that are being spent in the most effective and efficient way to serve survivors and address human trafficking or reduce human trafficking in our state. So this was really a convenient sample. We used a snowball sample because we started with a list of about 100 people. At that time, Dr. Reed had already been doing research in Florida for quite a long period of time on this topic. So we pulled all the experts we had together, and we made a list of about 100 practitioners that were in the field that were working in the anti-trafficking movement, representing many stakeholder buckets. I'll talk about those in a minute. And we started reaching out to them to be very strategic for representation, to invite them to do an interview with us. And the goal of the interview was really what is needed. We were trying to identify something the community needed that we knew could fall in our wheelhouse as academic researchers and in the lab, that could be one of our major hub projects that we could do to give back to the community. So we had initial information from that assessment. People needed funding. Data was a key. There was another question that had been in the Q&A about why Florida ranks third. I kind of answered it there. We'll be kind of talking on that throughout. They needed also to know what services were available where for victims, and where were the gaps in services. And gaps being location, but also which types of victims could receive services and which types of criteria might inhibit a victim from being able to access services that they needed, and they needed to know in real time. And it was interesting because everybody said there's issues. We collaborate, but yet we don't, and there's issues with collaboration. So we always kind of find that very interesting. Next slide, Kaylee. So for that background and that needs assessment, these were the different, what we like to call buckets of the key stakeholders we were interviewing with that initial 100. We wanted to make sure we had representation from all of these groups at all levels, and for every region in the state to the best of our ability. Of course, when you're doing a convenience or snowball sample, you may or may not get the same level of representation everywhere, but we were aiming to have some decent amount of representation in all of these systems. Our goal was, what does everybody need? What is something that was consistently coming up? And what I mean by all levels is those frontliners in the field and the trenches, all the way up to the CEOs or the chiefs of police or sheriffs, to politicians in the state, politicians at the local level, as well as statewide. Go ahead, Kaylee. So what we found in this initial needs assessment was there isn't a cohesiveness between agencies. The issue of siloed data, every organization, and what I mean by org, these were more our government organizations like FDLE, DCF, Department of Health, Department of Education. They all were kind of tracking their own data, but it was just their data. So there was no hub with that siloed data coming together to get a really good picture of what's happening in Florida. Also, the data isn't really publicly available, so no one really knows when we see the Polaris data, how accurate that is to what organizations are really dealing with in Florida. We also found collaboration and education. Everybody said were the key to ensuring the best service delivery for clients or for survivors. And people talked about there was a lack of resources. Then it was more of a funding issue. Providers are doing the best they can. What we tended to find as we really deep dove into some of those comments more is the way funding is set up. It kind of causes providers to be competitive with each other, in the sense that funding will come down for just certain needs, not the whole spectrum of needs survivors might have when we're talking about resources to serve survivors. And so they fight for the funds. And the way they get funded is I have to show I served a particular person, like a count. And so even though they want to work together, the way funding comes causes them to almost fight with each other to ensure they can keep their own funding. Or there may not be funding for programs that are needed. And so that's why we have that gap in service. So there might be a provider that wants to start a particular program, like more long-term transition stable housing, but all the funding that's coming is driving towards crisis intervention, as an example. So those are just some of the added things that kind of came up, we started picking up on around some of these topics. But go ahead, Kaylee, the big thing that came up for the lab that we found that we were very happy about was everybody wanted good, accurate data. And everybody wanted better access, more efficient access to service. Next slide, Kaylee. So of course we were happy about this as academic researchers at a university, because data is what we do. And I am full transparency with everything we're building. That's really what we like and what we want to have is the data, because we're researchers and we like to ask good research questions of the data and have good data. So when we ask the questions, we can give good answers. So these were our two key findings, and the two programs that are our hub programs. Like we said, we wanted to gear towards making sure our biggest programs serve what the community needed, was good, accurate data. That's TIPSTR, and Bright brings in data, and better access to services, and Bright brings in that. So this is what we're going to be the meat of what we go through with for you all today. We're going to discuss how we built and developed Bright, where it's at, and we're going to give you a demo and how you can become involved. And then we're also going to talk about TIPSTR and how Bright and TIPSTR are going to come together to create a much better picture of prevalence and rate and what's happening in the state of Florida related to human trafficking. So with that, what is Bright? So Bright is a vetted online secure resource referral network for those who provide services to victims of human trafficking. We should add to this, Kaylee, in our little elevator pitch here, it is also for those who are looking for those services, to find those services and to find them in a quick, efficient manner. Next slide. So our vision and mission for Bright. So our vision is we envision a future where survivor voices, transparency, and data-driven insights can become the standard for all anti-trafficking policies, programs, and service provision. With that, what we see our role as the university, other than building and maintaining the system, is providing that data-driven insights and transparent reports of those insights that can be used for all anti-trafficking stakeholders that represented in all those buckets, but to also build this system in a way that it is useful for all of those buckets to do better, more efficient victim services. Bright, it seeks to disrupt human trafficking and elevate the standards of care for survivors through transparency, clear communication, collaboration, and the empowerment of survivors. Built from the voices of human trafficking survivors, service providers, and data-driven insights, it is a vetted, secure referral network that promotes survivor-centered care, facilitates efficient service access, and informs comprehensive evidence-based trafficking efforts. You have to remember I started as an advocate, and my undergraduate degree is in public health education, although I'm a criminologist. So that's some of where this drives. Everything we're going to show you today and we get into with Bright comes from this mission and vision, and everything in Bright, every filter, every click, every aspect is driven from the research we do with all of you and what you tell us you want that system to be able to do and what you need to be able to get from that system. So if you don't like something in there, know where it came from. We work very hard for it to not be what we think should be in there, but what you all say it needs to be. we put our researcher caps on to try to do the bigger picture thinking to make sure it simultaneously is collecting the type of data that'll allow us to put reports out that fit what you also tell us you really need to move the needle in the state of Florida, direct those victim service dollars in the most efficient way, and address those gaps in services. So next slide, Kaylee. So this is a model we try to think of as bright. I came up in the domestic violence era, and I studied a lot of domestic violence and worked within that field for quite a while. And I know the idea of coordinated community response kind of came through that. And we look at Bright as being a model that's taking technology to better help you all create a way to coordinate your responses. It's not a case management system. It's a place that allows you to be able to go in and find each other. Or if you serve victims, let's say, of domestic violence, even if your program doesn't offer human trafficking services, you do encounter human trafficking victims. It's a platform you could come into to find human trafficking services that you might need for that client you're working to serve. Next slide, Kaylee. So here's our methodology that we follow, and from day one, fall of 2020, that needs assessment, and we have never stopped collecting. So our initial needs assessment was around 100 people, and we quickly knew long before that we had hit saturation to know it was the better data and that you needed a direct service connection. I remember when I was a cop, which was quite a while ago, having someone, let's say, that I had to pick up on a Baker Act, and they were relatively stable at the moment. And I was trying to find maybe a bed for them in a facility. And I would have hours upon hours of myself and our dispatcher trying to call the few places that might have a bed and figure out, would they take this individual? I can tell you from a law enforcement perspective, if you're that patrol officer, the last thing you want to do is take that individual to jail. But on the flip side, you can't have, your job is to go back and answer calls. So you're stuck. It's like, what do I do? And then you're out of service. So the rest of your crew are working to address the calls. And if you're short people that night, it can actually create a danger. So I was appalled when it was 20 years later and I was doing these interviews with human trafficking, individuals serving human trafficking survivors and law enforcement, telling me that hasn't really changed, that with all the tech we have today, for whatever reason, this is what's still happening. And I thought there just has to be a better way. There just has to be. So our methodology is this. I like the Venn diagram because when we talk to the practitioners, we're always talking to survivors. It has to work for them. Practitioners are your NGOs, and then all of the state agencies. We're constantly trying to build Bright with that middle, how it can serve all those groups and serve them equally, not prioritize one of those groups over another because they're all important. We do this, the other diagram shows you, through ongoing interviews, focus groups, and then system tests. So we are looking at both the usability of the system, like UX research, but in addition to that, the data and the components of the system, of the entire model that involves vetting and a wide variety of other things. So go ahead, Kaylee. So we were funded, and a big shout out to Hillsborough County Commission because they gave us a wonderful grant after about our first year or so of working to build this off of pretty much zero funds, which allowed us to look at this kind of county area to build a pilot of Bright. So we did a SWOT analysis. We piloted it for 9 months. We started with 5 initial organizations. We ended with 15, and we were testing our current. We did not build the tech in-house at that time. We were using secondary tech as a way to just see how this idea was going to work and give us a better idea of what we would need to build. Go ahead, Kaylee. So our initial pilot analysis, what that allowed us to see is They needed it to be easy to use, or they found it easy to use. We create a filtering system. We've always had an advisory council that's made up with survivor voices and practitioners from the field. We don't incorporate anything into Bright that they don't give us a green light on as really being high standards of care and the direction the field needs to go. So I asked them when we were working on the mission and vision statement, what is or isn't Bright? And they clearly said Bright is not a simple database of services. It is an actual active living system that provides filters so you can quickly and robustly find the services that actually could serve your client and that specific need and send that request, which is very different from what I know of. When I was an officer, we had 211. I know it's still around. It's still very different for that. So that was one of our strengths, that it had those capabilities. It also, we had organizational capacity at USF, and we were also able to identify correct users of the systems for some of the things we were working to do. We had a universal referral form was needed when we looked at the weaknesses. And for some reason, we didn't have usage of the systems. So that was something we really wanted to look at further. And then everybody asked for a creation of an app moving forward. So go ahead, Kaylee. So at the end of the pilot, because of some of those weaknesses and those gaps, we wanted to do follow-up research and make sure we had actually got it right with our initial needs assessment. So we did focus groups moving forward. And in this, because at this point, you know, this is my baby, I'm pretty much biased. I had to pull in some of my outside other faculty at USF to say, hey, I need you to run this research, because I was worried I would be biased. And I said, I need you to tell me, did we just not get it right? Is that why they're not using it? Did we misunderstand and we didn't build it how they wanted it or needed it? Next slide, Kaylee. So in doing that, we wanted to replicate that initial needs assessment. We used a different methodology. So we did focus groups since we had initially used interviews. We conducted 6 different focus groups at a large community meeting in October of 2023. Each focus group was facilitated by a trained TIP lab researcher. And as we did that, we split those focus groups up based on the kind of roles. We are guided by what is in the literature as to the main categories we see as victim services, combined with what we have learned from the field in Florida to break up those types of roles. And we had 2 general questions. One was part 1, we wanted to look at service provision, and part 2, the perceptions of Bright. So next slide, Kaylee. So after we conducted that focus group, now keep in mind, even though we were doing that focus group, we never stopped when we were meeting with providers to ask the same questions about Bright and the system, demoing it, showing it to them, and asking them, and taking all of that qualitative data as well and mixing it with what we already had from the needs assessment as well as the focus groups. And when we started to analyze the focus groups, what we did was we recorded and transcribed all of them. The facilitators debriefed after their meeting, and TIP lab members who are trained faculty did the coding and the transcripts to help make sure we were identifying the correct themes. So go ahead, Kaylee. So once we put all of that data that we've had together, here are the key themes we've identified and moving forward and how we are trying to build Bright to be of service for you. One was identifying what was definitively the current referral process, which is how organizations find services. Then issues with the current referral process, things that make it difficult, because our goal is to address those things and make that easier and better for you. What should our involvement be in doing that? And then what are the client concerns that came up? Go ahead, Kaylee. So with all of this, our current general findings are with the current referral process. Now, as I go through these, this is where I would like to engage you all. you tell me with either thumbs up or thumbs down or something in the chat, or if you have a question, if it sounds familiar or what you experience is very different. And I do that because we're always trying to get feedback and make sure we're getting this right as we build it. So basically what we heard was the current referral process involves, I describe it as someone's personal Rolodex. This is, I've been in the field and I know so-and-so and I have a relationship with them and I know what they provide. And they're in my inner circle and I trust them. And so when I have a client, I think that their services meet my client's needs. I either start calling those people on the phone or texting them to find out whether or not they have space, and or can they, even if they do, make sure they can take my client because they might have a specific special need I have to check in on. So I'm just curious, does this sound familiar? Give me some feedback. Does this sound like what's happening or not what happens in the current referral process? A couple thumbs up. There we go. So we also heard from people, though, that as much as that can be annoying because it takes a lot of time, and the client concern with that is if they can't take them because, let's say, they're full, the client's not seeing or hearing that, and the client is feeling rejected and or having to tell their story over and over, which isn't a good trauma-informed approach. But a positive we heard to that was that those phone calls at least were somewhat important because it gave providers a chance to just kind of commiserate a little bit with each other, and they didn't want to lose the personal connection. The next thing we heard a system had to be vetted and it had to be safe. And this is paramount, and we shouldn't let them into Bright unless they can pass that. However, we heard a lot, if you were trying your personal inner circle and no one was available or they were full, you would start Google searching to find something. It reminded me of when I was a cop and I had the person in my car and I was like, there's nothing. And I started feeling like my only resort is jail. I don't like jail, but I'm starting to get left with no options. So we did hear people start doing Google searching and sometimes do emailing. Next slide, Kaylee. So some of the quotes we got from our providers that got us to that was, I'll generally send out 2 or 3, sometimes 4 different texts to different people. It's just, that's not efficient. A key we heard was the relationship. This is very much a relationship business. You guys, when you have someone you trust them, and that's who you prefer to send your clients to because you know how vulnerable they are and you want to make sure they're safe. So that is a key thing. So we heard it's important to not lose that as we build Bright. Go next, Kaylee. More of our general findings were, okay, so what are the issues? I call this the pain points. So what we do with Bright is look at what part is working for you. Let's try to retain that. But what parts are painful, or your pain points, or your current issues with the referral process? And if we're going to build this system, let's make sure it improves those things. And I touched on a couple of them. The trauma to the client, when let's say the client needs 4 different types of services and I'm calling each of them and I have to keep putting in the client information, or the client has to keep retelling versus it just all going at one time. People felt like that was traumatic to the client. The incomplete client data. What we also got with this is I get a lot of referrals that are, say they're a human trafficking victim, but then when I get them, they're not a human trafficking victim or survivor. They're actually something different, but that impacts their funding. And it isn't that they wouldn't serve them, because they probably can still serve them, but it's about what funding pots. It was important that they have some complete info to know, or the info had to be on just the right things for them to know, can I actually really serve them? Because as you all know, different funding sources give you different restrictions as to which types of clients you maybe can or can't serve based on if have an animal with them, or their age, or their sex or gender, or if they have children with them, those, or if they're drug alcohol addicted or mental health issues. There's all kinds of key client attributes that are important for you all to know to be able to determine, can you actually serve that client? And then another issue is lots of organization and staff turnover. And what happens with the organization and staff turnover is they leave with their personal Rolodex. They were the person everybody trusted. A new person comes in. People may not trust them, or they don't have the Rolodex. They have to recreate the Rolodex. That takes time. Does that sound familiar to everybody? And this is time, and it's extremely time consuming, and you all need a more time efficient way. Get one thumbs up. Yeah. So go ahead to the next slide, Kaylee. Right. So these are some quotes we got from individuals on that current referral process, which is, I remember when I first came in, you don't have the resources, you don't have someone's personal cell phone, it's a problem. A lot. And there is no, what we know is standardization and determining, other than that relationship, what standard of care someone might be receiving on the other end. We keep asking victim survivors the same damn question. I love that, over and over and over, and inadvertently re-traumatizing them. Is that something you all can relate to, the issue of potentially re-traumatizing? I ask because one of the side projects to address this client concern we're trying to work on in the lab now is a form of a universal intake that would get the bare minimum that everybody always asks that could travel in our system. So you all have that and don't always have to re-ask the client those same questions. So next slide, Kaylee. So finally, our overall general findings was, how will Bright work? So our key findings here is, number one, it has to be a vetting process. We have to establish a vetting process and work to establish minimal standards of care for human trafficking survivors and clients. So we have worked on creating that vetting process. Kaylee will be talking about that in a moment for you. It has to be easy to use. We've worked very hard at trying to get this as easy to use as possible, but you're about to get a demo, so you're going to see how well we've addressed that. And a key thing, though, was still, okay, easy to use. We want to use the tech, but we still want a form of a human connection. So can you build things into Bright that will allow us to still make that phone call if we want to have that connection, but not require it if we're in a crunch or in a hurry? And then another thing we're finding is this all or nothing mindset, which makes it very difficult to build the network part of Bright, which is you all coming in and using it, which is everybody will come in and use it if everybody else does. So we're trying really hard to get out there, show people what Bright is, and onboard as many of you as possible into the system. And so we're encouraging all of you to please start to take that step with us and at least start to see what the system is like, because we don't really know how else to address the all or nothing mindset other than just coming and talking to you and helping you all get comfortable with seeing the system as something that could be a benefit for everyone. The other thing is client testimonials. So wanting to see from clients how well the system works. So we're working on adding that in. They want, can we help make it more collaborative? So this is part of that vetting process. Are we sustainable, and can we have longevity with it? And those orgs that are newer versus more longevity, and how we deal with that. So go ahead, Kaylee, to the next one. So some of the quotes we got on how organizations from our pilot use Bright that you can see how we came up with those themes. I mean, one of them said, it is easier to call someone and say, hey, do you have any beds? So, or is it easier to use the system? So one of the challenges we're finding related to that is we're trying to move it to be an app as well. We're trying to make the system as easy and user-friendly as possible. However, the challenge is you all have been doing business a certain way for a long time, and we know it's hard to shift and create change in what that just pattern cultural behavior is. And that's what we need your help with. Kaylee, next slide. All right, so the overall theme. Direct service providers currently rely on personal connections, their inner circle, to find services for clients. One issue with that, and this is a secondary thing with Bright, is when you're doing that and you're all on your individual cell phones, you cannot find and reach each other. Like, we don't collect that data, right? So if we're not collecting that data, we can't identify gaps in services, where they are and who they are. It's kind of siloing that data. Next slide, Kaylee. So this is one of the things we want to address with Bright is, one, it's free for service providers. Two, if instead of using all your individual cell phones or things outside of a system, if all the data is in the system, we can identify resources and service gaps. We want to be able to then create reports to fund for you all to see, to increase your funding and policy, and have a real-time service referral connection. And most important, it be vetted. So on that, because I've covered all the research, I'm going to turn it over to Kaylee so she could quickly talk about the vetting a little bit and give you about a 3-minute, 4-minute demo of Bright.
Yeah, absolutely. Thank you so much, Shelley. Oh, there we go. So to give you guys a very brief overview of the way that the vetting process works for Bright. So it is a phased vetting process because we don't want to ask too much of you all at once, because we know that you all are very busy serving the clients, and we want to make sure that we're making this process as easy for you as possible. So that way it's making that connection to those clients as easy as possible. So as you can see by this graphic here, we do look at a couple of things in each particular phase, and within each phase we do want to have a meeting with you guys too, because we want to build that relationship with you all just like you guys build that relationship with each other. So in order to be able to have access to send referrals in the system, to be able to find those other providers, we really are just doing like an online presence review, making sure that everything looks good. We'll take a look at some different charity sites, and like I said, we do want to have that introductory meeting as well. So one area that it does start to vary, so as you can see on the bottom there, it says that from bronze and higher, you can send and receive referrals. For the different types of services, it can vary to what specific level it takes to be able to receive referrals in the system. So basically what that minimum threshold is for an organization. So for those that provide daily needs or transportation, that would be bronze. So we're just doing a little bit more of a deeper dive into the background of your organization and those staff members. For those that are providing legal services, mental health, case management, education, employment, or any type of peer-led support, that will be silver. So we're at least looking at your intake form, your hiring policies, and your program manuals. And then for those who are providing residential services, crisis intervention, substance abuse services, or advanced mental health care, the minimum threshold would be gold. So again, this is phased, and we do it in, separated time periods. So it's not like we're asking you for all of this information all at once, and we'll work with you within a time frame that is convenient for you guys as well. So if you give me just a quick second.
So as Kaylee's, as you're moving over, Kaylee is moving over to go to our live version of Bright and show you a demo of how the referral process would work, please feel free. Go ahead, Kaylee, move as you go. Please feel free to put any questions or comments in the chat as she goes through the demo. I'm looking at that, and I'm watching our time as well, Robin. I saw your warning for us. So, but one of our goals today, and we also have online with us, Ashley and Megan, who both also are working with us to build out the state of Florida. They work directly with different service providers. So feel free to go in the chat if you have an interest in them reaching out to you moving forward. Kaylee, I just see the PowerPoint still.
Okay. I thought I got
there you go.
Out.
Yeah, no, not your demo screen.
There we go. Did I get it sorted now?
There you go. So
Perfect.
Please feel free to find Ashley Petrie. Gosh, Ashley, I can never say your name right. Petrie Baker and Megan Scott, and if you're interested in learning more, having a demo just for you or your org, they can take that information through the chat.
Can I also take a moment to, Shelly and Kaylee, and just
Yeah.
say, Stack is a proud pewter member, right?
Yay!
Started the first steps, and it was very easy and very, I encourage everybody to, yeah, exactly. And we're about to do the next step. I got something from Ashley for our next step too. So we'll keep going up the ladder as well.
Awesome.
Thank
Thank
you
you.
for that. Thank you. Go
Yeah.
for it, Kaylee, on your demo.
Yeah, absolutely. So when an organization logs into Bright, this is the first screen that they will see. So on this very first page here, we do have all of the different hotlines for our organizations that have been vetted, and we know that they will answer 24/7. So we did want to make sure to put those there because we know if you need an answer right away, you don't want to go through the different portals to get that answer. We do also have our organization list here. So what you'll see, and I'll just do Citrus Health as an example. So you'll see the vetting tier level of that organization, and then you'll also see a quick description of that organization, and then the specific counties that they're able to serve if they do have any particular restrictions. And then if you open up the organization's profile, you can see their phone number, their website, and their specific location if you did want to learn a little bit more about them. We do also have a data entry portal, which is a little bit more specific to TIPSTR, so I'll go into that in just a moment, but I do want to show you this referral process very quickly. So for an organization to start a referral, we're just going to click Begin New Referral. And the very first step in this process is that informed consent. So we don't have an informed consent form on our own because we know that does vary from organization to organization. So it's really just there as a reminder to make sure that you've gotten that informed consent. So once you click that box and you click next, what you'll see here is the next step, which is completely optional. It is not required to fill out. It's really just here as a tool for you all to utilize. So this is the QIIT screening tool. It's a quick 4-item screener that helps you know if the individual you're working with has been trafficked. So if they answer yes to just one question, there's an 80% likelihood that they have been trafficked. And with each question that they answer yes to, that goes up to about 97%. If they do choose to fill out this screening tool and they do have a positive result on the screener, there will be a little indicator on the referral that is sent. So once we click next, this is where we start to enter some of the information about the client. So we collect the first 2 letters of the first name and the first 2 letters of the last name, followed by the last 2 digits of the birth year. So those 3 pieces of information, in addition to the birth state, help us create a unique identifier in the system to make sure that we are not having any duplicates in Bright. We do also collect on the ethnicity and the current city and state. You'll see there that we do also have a space for the email address and phone number. It is not required. It is for the client, and it's only if they're in a space to be contacted themselves. Because Bright is for the entire continuum of care, they may be looking for a home loan or safe banking, so they may want to be contacted themselves. So each of these things on the right here are what we utilize as filters in the system. So we use their age range, their gender, their trafficking type, their current housing status, their citizenship status, and the preferred language that they speak. We do also have a list of different client attributes here that providers have indicated can prevent an individual from receiving services at an organization. These are multi-select, so you can select as many as apply to your client if you would like to. But once you've got all of that information in, you just click next. And then what you'll see here are all of the different categories that are included within Bright. We do have a short description underneath of each one, and you can select as many as needed for your client. So I'll just select a couple here. So I will do case management, crisis, housing, and legal services. So once we click next, what you're going to see are a list of all of the specific services that fall under those categories that you had selected. We do also put a brief description underneath of each of those categories as well, because we know it can vary among the different victim services. So again, I'm just going to select a few because you are able to search for as many as you need for a client at once. Once we've got all of those services in and we click next, what you're going to see are a list of services that are able to serve your client and their specific demographics in real time. So what's really neat about this system is it's super easy to send a referral. All you have to do is click send referral, and then you do have the option to add in a comment if you need to. So if I had put in a phone number for that particular client, I could say, this is for Kaylee. And then those comments do delete out of the system once the referral has been accepted. So we just click send, and we could click send for all of these as well, but I don't want to do that because that will send a referral to our partners in the network. But once we click finish, you're able to review all of the client information, and then you would also see a list of all of those different programs you had referred them to. And when we go back to the home page, there's one last thing I wanted to show you guys. So because I had filled out that screening tool, there's that little indicator right there. And when we scroll down, this is the referral I had just filled out. If we do find matching services and I click back, so say this is somebody that you're working with for an extended period of time, you can easily redo that search without having to put in their information all over again. So you can easily just focus in on those new services for your client. So I am going to stop sharing that, and I'm going to switch.
Kaylee works to switch over. So you all know we are at our kind of launch of minimal viable product. We're constantly making tweaks. We're always open to suggestions of how to improve the system. We currently built the system primarily from NGOs feedback, and our goal is working with other organizations like law enforcement. We recognize your pathway portal might need or want to function a little differently. So we're launching this year further research to start working with law enforcement groups, medical groups, to make sure you have your own entrance portal and it flows in the way you need while we're building the service providers and services into the system. But another cool thing about Bright before we're out of time that we wanted to address is what it can do data-wise that answers what everybody said was important. So one of the goals is all those things Kaylee showed you, it collects that data. So it has all of these different features of data. Go ahead. That's fine, Kaylee.
Okay.
So some of the questions it can answer currently is how many clients, organizations want to know how many clients am I serving, or what services do I need more capacity for? What's my typical client? Next slide, Kaylee. And they wanted a way to report to their funders. So this is an example of a dashboard of the data. So this is what we can see as Bright. You see multiple orgs that are in there. We're going to be able to map. We have pie charts that are there. So if I were a larger org and I had multiple programs in multiple locations, you would have a page like this. And instead of saying different orgs, it will say the different programs in their locations, so that you can download a report from that will work for your funders. To go back and say, hey, I had this many referrals, but also how many you had to decline because you were full, so you can show I need more capacity. Next slide, Kaylee. So the other thing is looking at each individual org could have their own dashboard. So even if you're a smaller org and you have a few programs in it, or if you are just one program, you would have that. But let's say multiple people had like a license that they're using. Everybody gets their own login. You could see for all of your advocates or different people how they're working across, and you could get your own data. This is an area we're still building out, so we're very open to and want to hear if you have specific things that would matter to you, you want the system to show you of your usage and how you'd want that to present, so we can hand that to our tech provider to develop it. Next slide, Kaylee. So we're always working with Bright on data driving decisions. And so we're constantly doing continuous research, even things like today, questions we get, comments you give us, or feedback, features you'd like it to see. We look to incorporate that. When Kaylee, Megan, and Ashley are out in the field talking to different organizations, how should we build the tech? We're building the tech in-house. So if we need to tweak or change things, it makes it easier. And we're starting to do research now on what kinds of data reports with victim services do you want to see that we can pull from the aggregate data. We'll never put out there for everybody any one particular org's data to see. It is always the aggregate data of just gaps in services. So I'll give you an idea of some of that. Go ahead, Kaylee. Other questions we can answer right now is like, what are the gaps in services? How many services are in my region and what types of services are available? So we've been currently trying to identify all the different programs out there that serve human trafficking survivors throughout the state of Florida, build them into a big database so we know who to go reach out to and onboard. And so next slide, Kaylee. This will give you an example of some of the data we're going to be able to show and can already show. This is live data of what we've already been building out for Florida, of where different services are located. So you can see we can produce like the pie charts. We can produce a map of Florida. So you can see it kind of by counties, the different counties, locations. And you can also see we can pull it by the types of needs or services that a client has. Next slide, Kaylee. Questions that we want to be able to answer, but we really need you all to get involved to be able to answer these is like, how long does it take to get a victim connected to services? In order for us to answer this, we need you all actually using the system to make your referrals and connections. So we need you to onboard and put the services in, but even if you don't provide services, like maybe a law enforcement officer, but you encounter survivors, we need you to come in and be using the system to make the referrals because the system can track this. And then we can put it out there and get a better idea of how long it actually takes in reaching the service provision. The quality of service in the region, that's a question that this system isn't necessarily designed to answer, but by the vetting process, we are working on increasing the quality, and Kaylee went through those standards. So we track what level each org is, so that we could do that by a particular region and show you how many are pewter, bronze, gold in your particular region, and by what type of service that it is that's being offered. Services needed most, we need you using the system. That's those client attributes. If you input that, then we're going to be able to know what services are being looked for the most and which ones have the biggest gaps and where those gaps are located. These are just all examples. So we have just a few minutes I want to touch on before we're done. A little bit bringing you back to the needs assessment and the other aspect of it, which is TIPSTR and our statewide data repository. TIPSTR is very different from Bright. It's a very different project. TIPSTR was the state law that was passed that requires all government organizations receiving state funding that deal with any human trafficking survivors at all or human trafficking data to give us a data dump in the lab. Dr. Reed runs TIPSTR. So you can see on one side the different orgs that are represented. Specific to nonprofits, though, however, if you receive state funding, technically you're included in the law. The law also said USF needs to build a system to make it easy for you to provide us that data. That's what Bright is. So we do have an option in Bright that we just know your existence. And if you don't want to go through the vetting process or procedure, you can just fill out the application so we know your org and it has your data that way collected for your service provision, and you're just in that system, and that meets the burden that the state put forth and provides an easy pathway. Again, you can email Ashley or Kaylee or Megan to know how to do that. Go ahead, Kaylee. Dr. Reed built the vision of TIPSTR off of the United Nations Essential Practices of Human Trafficking Data Collection as the goal, a way we standardize the data, the defining and the measuring and tracking of human trafficking incidences in the state of Florida, the idea of data sharing and creating the repository, and then policies and resources being allocated based on that evidence. Next slide, Kaylee.
Yeah.
So the purpose of TIPSTR is to collect and analyze anonymous data It also is to inform statewide policy and to provide, we'll be providing an annual report to the state every year based on that accumulation of data. What are the prevalence and the rates and what kind of human trafficking is happening where. And also the repository eventually will be merging the Bright data in so we can better identify how to serve survivors. Go ahead, Kaylee. So Senate Bill 7064 is what drove TIPSTR and the mandate. And 1 through 7 there tells you that what is being collected with the type of data. Dr. Reed has been in touch with, we had the first year, we're entering into year 2. She's been in touch with all of the different government orgs that are mandated to give us the data, and the data is starting to come in. We have year 2 to start to work with that data and how we merge it so we don't have duplicates and we have good data. Year 3 to generate the report. So the victim service information primarily is coming through and being generated from Bright. And FDLE has been cooperating with us. They have been sharing the data, which gets at the disposition of investigations and prosecutions as well. And the annual report that we will put out to the state will be made publicly available. Go ahead, Kaylee. So we have certain partners already with TIPSTR, as you can see, coming in. Florida Health, Department of Children and Families, all of these government orgs have already been working with us and providing us data and trying to make this a really good, robust, centralized data hub for Florida. Go ahead, Kaylee. And our goal with it is, this shows Texas because our partners that Joan has are out of Texas for the tech, but the tech that she's using will be able to do this, which is data visualization. It'll provide that mapping and be able to prevent the deduplication of data. It'll be able to give us a risk and resilience score in different counties and location. An important thing we heard in the needs assessment was not just statewide data, but what you all refer to as zip code level data or local data as well. So everything we're doing can show the aggregate statewide county, but also down to a particular area or city for individuals or community in that city that want to address their individual problem. I think, Kaylee, did I miss anything important on TIPSTR?
Yeah, the only other thing I wanted to share related to this particular slide here that's really neat about the repository is that we actually have the ability to overlay the data on top of each other as well. So we'll be able to take however many screenings were done in a particular county, but then we can look at, for example, information from the Department of Education and see, okay, how did those prevention curriculums in schools work with those particular screening tools? And we can overlay all of these different factors with each other. So as well as seeing the true scope of what trafficking looks like in Florida, it can also help us better understand how we can implement better prevention and intervention tools as well. That was the only other thing I wanted to add, Shelley.
I'm going to address a few questions I see in the chat and on Q&A. Kaylee, if you could go back up to the data charts with Bright.
Of course. I believe this one.
Like right here.
Okay.
This is just an example. So someone's asking, is it going to be publicly available? Yes, what we're doing research on right now is what are the most important things that the stakeholders say they want to see and know as a report that is generated out related to victim services and gaps in services. We have a website currently with the university that's kind of an academic website. We're in the process of building a separate, more user-friendly website for Bright, where as we collect and have the data, we'll be able to start putting that out. An important thing to know, though, is some of those questions that come off of client attributes or other things, we can't get this kind of data you're seeing right now and create that report if you're not in the system using it. So Bright's data is only going to be as good as you all participating in the system. Basically, you drive how good that data is. In other words, we're really dependent on you. We see our role as building the best and most user-friendly system that protects the victims and best we can and provides a service to you all to motivate you to want to use the system and to keep it free. But we're open to feedback to learn and know what types of reports have the greatest meaning to the stakeholders so we can report we can put those out. So we're not inundating the site with a bunch of data reports that don't have meaning to you all, but we're putting the ones out there that have meaning on a particular basis. Same thing with TIPSTR. The TIPSTR data is a little different, but Joan, when she creates the report for the state, that report will also be housed on our website and will be publicly available for anybody to get a hold of. One of our goals is transparency.
One of the questions that was up here earlier, and Megan answered it. Thank you for that, Megan. But I wanted to bring it up in case someone missed it. Is what about individuals referring or someone being able to on their own self-refer? And you all described how it doesn't work like that. You would
Nope.
need to be going through an agency that's been vetted, and there are probably really good reasons for that too, right?
Yeah, so like I said, anything and everything we're doing, it's because it's what we were told in the research. So we were told that currently, at least right now, for example, if someone calls Polaris and they provide them a list of potential providers, victims will tend, especially if they're still in crisis, to make one call, and if they don't get a response, we lose them. And there was always the practitioners and survivors voiced a worry if they aren't connected with someone, especially if they're at a critical stage, to help them, that they might make one effort and go right back, and then we would lose them. And so they really wanted it to be, you can be someone who could encounter a survivor in your job, right? You don't have to provide a service, but you're going to encounter them. Like, let's say you're a doctor in an emergency room. You can get into Bright to make a referral. But to do that, you still have to be vetted by us to get in, and you'll have your login, right? And so, but you're not going to be vetted like an org with a service, right? But we're just verifying, yeah, you're an officer, you're a legitimate police officer, you're a legitimate doctor, and this is the course of your duty, right? We have a way that the clients can, if be the one that gets contacted once the referrals are sent, if that's what they want and they decide directly. We have been asked to consider creating a client portal so that if a client was initially connected with case managers or someone in the system, and later in their recovery long-term process wanted to come back and access services on their own, they would have the ability to. So we have that slated as potentially doing in the future. But we've also been talking to a couple of groups that have been already working on something like that to go, do we need to create it, or do we just collaborate with them, and what might that look like?
Great, great, great. Couple more quick questions. I think someone who is looking for the website, they just needed to see that QR code again, and your info was up. Somebody's asking if
I
Guardian
can
ad
pull that.
litem is
Yeah,
involved. Yeah.
I can. Interesting. We haven't gone directly to Guardian ad litem, and so you all know we're talking about those expanding groups. Right now, we're building this for adults. This is meeting adults. It's a little more complicated with youth, but we are working on MOU with DCF right now, and we are looking in this next year as one of our new groups, like law enforcement and health, to add in youth. Interestingly, we are in the process of hiring. We can see your screen. Oh, Kaylee.
Yeah,
Got your PowerPoint back up. We're in the process of hiring because we have federal funding. Finally, we have substantial federal funding, so we've been able to hire more support and really build this out for the state. Two individuals that are support individuals in the lab, and interestingly, one's been working within that space. So we'll probably be talking with her and gain knowledge from her of how we can partner with and work with Guardian ad litem as we start to look at that, adding that youth in.
terrific. And let me just say, first of all, we're almost at 2:30. You've answered all the questions that I've seen. Thank you. Let's stop sharing for a moment here. Let's see if we can get back on all together so I can properly thank you all for your expertise and for your team in putting this amazing presentation together. We really appreciate you, and everybody, you should know that Shelley and Kaylee have already agreed that next year in 2025, we hope to do another one of these with some updates, with more of us involved at higher levels and working to input that data you said is so important. I want to thank you too, because it's been forever. I know we've been doing this work. I've been doing it for over 20 years now. We've got such a need for this data and such a need to connect. You really are meeting a need in a very foundational and solid way. So thank you so much. The thank yous are pouring in. Amazing work. You all high five, high five. All right, everyone. And thank all of you for attending. At this point, you know, all of you, I hope, can look at this website, be in contact with all of the organizer, so you can see if this would be right for you to be a part of. Share the word in your local human trafficking task forces and coalitions that this is out there, that the program is there for us to all link in, especially throughout Florida. And we will have more questions, I know, and want to learn more as we go forward.
Robin,
And
a few people
yes.
are asking, how do we, I see Megan trying to answer. It's really easy to get in touch with us. You can Google any of our names with USF for the Bright Project. We got our QR code. You can get to Kaylee. You can get to me, Ashley, Megan Scott. Megan's on social media. Any one of us can help you figure out how to get in and start that process.
And remember, if any of you want to show this, and about, you know, next week sometime, we'll have this up to the website that I shared earlier on the surviveandthriveadvocacy.org website. You can share this information. Thank you all. Thank you very much. Shelley, Kaylee, Ashley, Megan, Lisa from Just in Time. Remember, next month, we're going to talk about survivors' financial empowerment. Really encourage you to go to the STAC website, register for that one, and we will see you next month. Thanks, everybody.
Thank you
Thank
so
you.
much.
Bye-bye.
Lisa.
Thank you, Robin.